If you're getting a lot of spark, your cut is too high. If your tissue is dragging, and if it's not moving smoothly, then your setting is too low. Again, the trick is to always be conservative. You can always take more away, but you can't put it back on. I know I keep saying that, but it's so important. And once you figure out exactly how much to take away, you will be removing lesions with absolutely superior scar results. We're on 5. And you want the smallest, really the smallest amount of power that you can get where you still glide through the tissue. So actually on this particular patient, this is a good setting. But you have to remember, these are relative settings. On somebody else, I may need 8 or 9. On somebody else, I may need 3 or 4. For the most part, I think 5 is a pretty good starting point for your pure cutting. Just a slow wiping motion, and the reason I'm not going real deep is because I'm resting on this finger. It's my finger rest, and I'm able to control this very, very precisely because I'm using the other hand as a rest. See how nice that works? I have an $80,000 laser I could use on it, but the Elman works quite well. So we're going to stretch the skin.
There you go.
And all right, small pickup. Going to. And you know, remember we were talking about a pressureless incision. See, the problem with the scalpel is that it wants to distort everything, and it wants to push everything out of your way. Have a pickup, please. Mm-hmm. So there's our specimen. So obviously, if I was extremely worried about this lesion, radio frequency, and this is one of the advantages. Now we're going to go back and just